I've been receiving some queries and concerns from patients regarding the draft changes that AHPRA has made into how patients can access cosmetic surgery in Australia. Now, AHPRA have released these in draft form for medical practitioners who perform cosmetic surgery and procedures like injectables, and they're due to come into effect on the 1st of July. There's currently some debate within the industry about them, so we aren't certain that all of them will be implemented. And a lot of them are things that good practices already do. But some of them are a little radical and unexpected, and they're understandably causing some concern and some panic amongst people who are planning surgery. Now, let's assume that they do come into effect. If you're looking to consult a plastic surgeon for a cosmetic procedure in Australia after the 1st of July, AHPRA is going to need you to do a few things. You'll need to have a referral from a GP or specialist, but there are requirements around this. For example, if your normal GP or referring specialist also performs cosmetic injectables or procedures, they're not allowed to refer you to a plastic surgeon for this kind of surgery. And it has some consequences for patients who are being referred for a second opinion or ongoing care from specialist to specialist, which often happens in the best interest of patient care. It also has consequences for patients who just don't want to discuss their cosmetic surgery with their GP. And unfortunately, from time to time, we do see confusion around referrals, and we do have GPs that do refuse to provide them, particularly with things like post-pregnancy abdominoplasty, which can be both cosmetic and also medically required. So patients may need to find themselves having to see multiple GPs in order to get a referral just to explore surgery discussions further with a specialist. You will have to disclose whether a medical practitioner has ever declined to provide you with a cosmetic procedure in the past, and you will also have to undergo mandatory psychological testing using a screening tool. And the results of this will become part of your medical record. And yes, this even counts if you're having injectables at your local shopping centre clinic. Any practice that doesn't follow these rules is breaking the law. And if you make it to the point of actually being able to have a consultation with your surgeon, you'll need to have a second consultation with your surgeon. And then after that, you'll need to wait another 7 days until your surgeon's allowed to offer you a surgery date. And it's only then that you'll be permitted to book in your surgery. So when looking at this, we remember that most people who access cosmetic surgery are women. And they do so after experiencing the physical and emotional toll of pregnancy, raising children, weight loss and other stresses in life and life changes. And in my 15 years of experience in the industry, most women who seek cosmetic surgery do so after about a decade of careful consideration and thought. It's usually the first thing that they've done just for themselves in a really long time. There's really poor demographic data for cosmetic surgery in Australia, so there's limited research showing who the average patient is. But these regulations seem to misguidedly assume that most patients have underlying psychological conditions and require multiple barriers and hurdles to access cosmetic surgery or even injectable treatments because they can't be trusted to make their own decisions alongside their clinician. All patients, even if they've never had body image or mental health issues, will unfortunately be forced to undergo a body dysmorphia test whether their surgeon thinks they need to or not. All surgery does carry risks, and these absolutely apply to cosmetic surgery. But most cosmetic procedures have very low mortality and morbidity rates compared to other types of non-emergency and elective procedures that carry much higher risks of death or injury, but interestingly enough, aren't actually having these kind of hurdles and hoops posed for their patients in order for them to proceed or even just investigate the surgery that they're interested in. I believe it's yet another intrusion into what women do with their bodies and whether or not they can be trusted to make autonomous decisions about what they do with their bodies alongside a specialist qualified plastic surgeon without disproportionate interference from the government or authorities. We are genuinely supportive of sensible and realistic measures that truly protect our patients, but some of the new regulations that are really concerning for our patients will add another layer of cost and stress and judgment to what they want to do with their bodies. Your plastic surgery practice will be there to support you through that process and provide you with more advice as these measures come into effect.